Well, I am Brianna Coleman. I am the manager of education for the revenue cycle, and I have been here for a little over a year. I started in June of last year.
My name is Tiffany Perry. I'm the manager for patient registration. I have been with the organization for 11 years this year.
My name is Lisa McClendon. I am the Director of Business Applications here at the organization, so I support Tiffany and others throughout. And I've been with the organization seven years now.
So St. Joseph is a godsend for me. When I first came and I started to learn the processes and the systems, I realized how much they cared about the community and how much they actually cared about the patient. Instead of being a healthcare system that just cared about the numbers and how much are we bringing in, how much are we making, they actually care about the care of the patient, and that's their first priority. They say it in our mission statement. So the fact that it's rooted in God's love, we care for all patients, and I love that they have so many different programs, so many different things that they offer to all patients in the community.
It means a lot. That's what our patients remember, is how, their first encounter, when they go throughout their treatments, they still don't never forget how they were acknowledged or handled for their intake. So it's extremely important.
Because we are the first line of defense. We're usually the first person that the patient interacts with at a lengthy time. And so if you are non-compassionate, if you are nonchalant and just disengaged, then the patient will feel that, and that will affect their entire experience. So we get to focus on the things that matter. We know that we have to show that compassion, and you don't want a frustrated registrar when they can't remember how to do something if it wasn't in place. And because if they're frustrated, it shows to the patient becomes frustrated, and then it's a domino effect. So it really does help the registrar focus on the patient and getting the patient registered as quickly and as efficiently as possible, because we know that they're in pain and this is the last thing that they want to do.
I think what sets us apart and what really brings it together, as Tiffany mentioned, is our vision and our values, and rooted in God's love. And that's what we really feel. Everybody's here because something has brought them here, whether that be a crisis, whether that be for answers. And so we really need to just think about why they're here and put ourselves in their position, because we've all had to do it too. So I think being in healthcare gives us a little bit of an advantage. We understand the system. However, patients coming in here, this might be their first experience with healthcare, with a doctor, or with a facility as large as ours. So just trying to put ourselves in their perspective, and I think being a part of the community for over 200 years allows us to really feel and see the impact that we cause.
So as Lisa mentioned, now we're probably looking at reg at a 2 to 3 minute mark. Prior, you probably would add an additional maybe 2 to 3 minutes, simply because you had to print out the physical face sheet, take the face sheet to the patient, then bring it back to your workstation to scan it in. Then take it back so it can be on the patient's chart. So now with Access, those 2 to 3 minutes we can kind of eliminate, because we are launching, the face sheet on a pad through our cows or either at, our workstations, and we're able to submit it, real time, and it's available for anybody to pull off the patient's account.
I have learned that the easier the process is, the happier the registrar is. If we can put things in place like Access that we have to make their jobs just a little bit easier, because again, they're registering at least 50 people a day. If we can put processes in place that help them make their workflow more seamless, they're excited. They're like, oh, this was a great day. I didn't have a terrible day. So it really does help their well-being and their livelihood, because again, anything that's easier and more seamless helps them be able to, one, focus on the patient, and their workflow is a lot easier.
Again, speaking technology, we have a lot of vendors that approach us constantly about saying, hey, we have the next great product. And we know that there's a partnership there. So if something's not working, it's very easy to get Access and Meditech at the same table to work it out. And that goes a long way for me and my team in the IT aspect, to be able to know that ultimately I'm going to have a solution.
So the future is going to be definitely bigger and brighter for St. Joseph's. It's already in process and development for a lot of it. But I do see us being more technologically advanced and having where some patients like to be self-sufficient. So you have to be able to cater to those patients who are introverted, who don't really like to talk to the registrar, get the information. Being able to have them have those processes in place where they're self-sufficient and they can do their check-ins on their own. I think that is going to be a great movement for our health system as well.